Every year in Nigeria, hundreds of children are diagnosed with cancer. But for many, survival remains slim, not because treatment isn't available, but because help doesn't come on time. On this special episode of Gyna Plus, we step inside the Pediatric Oncology Unit at the University of Nigerian Teaching Hospital, Ituku-Ozalla, Enugu, one of the few places where children suffering from cancer can access treatment to understand the burden of childhood cancer. To put this in perspective and explain why the early signs are often missed, the pediatric oncologist gives some background.
Cancers in general are diseases. Only normal body cells, they multiply out of proportion. There's no regulation. They just continue to multiply and proliferate, and many a times they form a new growth in the body. So when you say childhood cancers, it means cancers that occur in children.
Okay, but how common is it? Because I would like to make reference to the woman I spoke with, before earlier on. She said her child was just 1 year, 2 months old when they realized that he was having a growth. And by the time she got to the hospital, she didn't even know what it was. So first of all, how common is it? Do you think there's enough awareness for parents when it concerns cancer in children?
Childhood cancers are common. But probably because we have a lot of other diseases like infections, malnutrition, we think that childhood cancers are not common. They are common. When you come to the hospital, you see many. Like in a year, let's say in just pediatrics alone, we can have up to more than 100 children presenting with symptoms and signs of cancer. So I can say it's common.
So, but now talking about symptoms and signs, for mothers who probably have no knowledge about cancer prior to what you're going to be telling us,
yes,
are there specifics that they should actually look at? Because I might have a child who's having fever. I think it's headache. I just give paracetamol. So, but it's just a certain thing that you should look at for. And when do you need to move, to the hospital?
Yes, you just mentioned fever. When a child has fever, most people will probably think it is malaria. Okay, they will buy paracetamol, you can buy anti-malaria. You give it for 3 days, the fever is not resolving. You should get to the hospital. Okay, then if you see anything growth in your child's body, like some people, I just saw a child this morning, when he went to take his bath, he noticed there is something in his tummy. He came out and alerted the father. The father came out. So the child had no symptom. It's just that he incidentally found a mass there. I started coming to the hospital. And we just examined the child. It is likely a kidney mass, a kidney tumor, a kidney malignancy.
And that means it's cancerous?
Yes, it's cancerous. Some other people will present that they start vomiting. The child is no longer growing well. So there are so many ways. But what we advise mother, once you notice something that is abnormal in your child, you need to go to hospital.
So, but in this part of the world, let's say in Southeast, and I know that UNTH is one of the centers around the region where children can receive cancer treatment. But what would you say are the most common kind of cancer, childhood cancer that are in this part of the area? Because I know we have leukemia and area, but which of them have you seen that is more like a recurrent incident in children?
Okay, we have common cancers in children. We just mentioned leukemia. We see a lot of it. We see cancers of the eye, what we call retinoblastoma. This one, you can see a child with something white in the black part of the eye.
That is cancer.
You need to go to the hospital. Okay? You can feel a mass, just the one I just described, a mass inside the tummy. you need to go to the hospital. So we have common cancers, leukemia, retinoblastoma, Wilms tumor, or what we call nephroblastoma. You have the cancers of the bone, they also occur in children.
These are all cases you've seen here.
Yes, and then the lymphomas. These are cases we see.
For many families, the journey begins in confusion. A child falls sick, and cancer is the last thing they suspect.
It started from orthopedic last year when it started.
As a leg problem.
As a leg problem. As the leg is the primary source of it.
Oh.
So it started in orthopedic. It was when the whole legs swell up. That's why they now referred us to this place. 3 swollen. We have one on the leg, then one on the face, then one on the head. Initially, they did not. The primary source of it, that is the one on the leg. They were looking for what it is, but they couldn't find it. But lately, they now diagnosed that he has something like cancer. Yesterday, the treatment started. So all these while it has not been easy because my son cannot even feed outside, so I had to find a way to cook for him so that he'll be able to eat. And right now, he's so tired that he cries every day that he wants.
It is fever and the swollen abdomen. At the stage, we thought it was food that he overfed or something like that, but initially, at the time, the left side of the abdomen was so hard. Like since they touch it, you think that it was stone that when they put that side. He was in pains, fever, continuous fever, non-stopping. So we took him to UNTH Medical Center. They now in Soka, yes. They now diagnosed of splenomegaly, enlargement of the spleen. So they were treating that one. The symptoms and everything was there. The thing was still persisting. They now said that they could not handle again. They referred us to UNTH here. So we came to UNTH. We did a series of tests. We did a CT scan. We did scan. Yes, CT scan. We did ultrasound. And they now found out that it was cancer of the kidney. When they broadcast the news to us, in fact, I thought that everything the world have ended on me. It wasn't easy. It wasn't easy at all on me. Because I thought how a little boy of a year, 2 months, should have cancer. And you know what it means.
So and then you were admitted into the hospital?
Yeah, we were admitted. We came here in November. That was November because it was a year, 2 months. So he was born on the 2019. So this thing started as in 2020. During the lockdown, yeah. It was 2020. So we were here by that November. December. She started chemotherapy November, December. January 8th, they did the surgery. They removed the left kidney. Then we went home after that surgery. Then we came back around March and started chemotherapy that took at least for 2 years. He was on chemotherapy for 2 years.
But how long were you in the hospital before? I mean, how long were you admitted?
3 months.
You were steadily here for 3 months?
For complete 3 months.
Most families don't get here early. Others simply don't know what to do until it is almost too late.
Generally, in this part of the world, one of the challenges we face is late arrival or late presentation. You know, unlike in the West, other parts of the world like America and UK, where mothers present or bring their children early enough to the hospital for treatment of cancer. The challenge you have here is that the experience here is that most parents come to the hospital with their children who have cancer quite late, and it's quite a big issue. I don't know what could be the possible causes. Maybe the awareness is not quite high, or maybe we don't make enough noise about childhood cancer. So we need to step up our game so that we can have these women bring their children quite early for treatment, because it's quite beneficial to have them treated early.
Okay, so with the cases you've handled over the years, and at what stage have you seen, like, what are the stages that you've seen that would be like, why did you come here on time? And from the interactions you had with mothers over time, what did they say they were treating before they found out that it was cancer?
So most times, cancer have different stages. We grade them or classify them. Most of them stages 1, 2, 3, 4. Okay, the fourth stage is usually the advanced stage. Yes, we call it metastatic stage. At that stage, the cancer had metastasized to different parts of the body, and at that stage, there is little or nothing you can do. For instance, if a child has cancer of the kidney, known as nephroblastoma or Win's tumor, if they don't present early, the cancer cells may find their way through the bloodstream to other parts of the body, commonly the lungs and the bones. And once they escape into those organs and you're treating the kidney, at the end of the day, those other cells that have escaped to other parts of the body definitely kill the child quite early. So advanced stage or stage 4, metastatic stage, once you see them, there is little or no hope for.
But mothers, with the experience you've had over time, what has been the reason for delay, for instance?
Well, most times, commonly, and what we see in our environment is that most mothers will present elsewhere before coming to the hospital. Most times, prayer houses, unorthodox treatment, going to herbal home, and sometimes most mothers or families feel that these are not treatable, or that these are done by somebody, maybe something that their relation or somebody had infested the child with something that is incurable, that has to be only cured through prayer or through herbal or native way. So by the time they've gone through those processes of going through prayer houses and native medication, those periods are delay periods. So by the time they are coming to the hospital, is already. Most of the cancers have some genetic basis. Yeah, so some of the cancers are gene-based. There are some mutations in the gene that usually predispose people to different types of cancer. For instance, cancer of the kidney, cancers of the bone, cancers of the eye, known as retinoblastoma. They have some form of gene mutation that are peculiar to those cancers. So once a child has those gene mutations, definitely they will present with that. And then there are some cancers that are common in specific age groups. Yes, we like neuroblastoma. There are blastoma types of tumors. Okay, the neuroblastoma that occurs in the suprarenal gland, the gland that is on top of the kidney. Okay, and then retinoblastoma. So those are blastoma type of tumor. So they occur in children, commonly children who are less than 5 years. That is where we see them. So it can also occur, yes, it can also occur in children that are less than 1 year. Even we've managed cases of children who were born with retinoblastoma.
For some mothers, this diagnosis means a more than illness. It means relocating, sleeping in wards, and spending everything just to stay afloat.
I left my job. For that complete 3 months. I came here. After chemotherapy, I came again. After the surgery, I came back again for the chemotherapy. Honestly speaking, as I'm talking to you now, and even that finance had not yet come back. So I need that finance to, pay people that I owe.
But do you think there are things mothers are missing now? Because, like in your case, it seems you spotted it on time.
Yes.
And then you probably gave some paracetamol because of fever.
Yes.
But you didn't. You thought it was food, overfeeding and stuff.
Yes.
And then you had to see a doctor.
Yes.
But do you think there are mistakes that mothers are making in terms of delay? The cases you said there were other cases around you.
Yeah.
But how was the outcome?
The other ones, the children that are suffering the same thing with me, all of them were not alive today. They all died. It's only him that survived it. Only him.
Like how many? Can you remember?
Any children?
Like up to 3?
More than. It's more than 3. They're more than 3. They died. But he survived it. Because we came on time.
Where do you think mothers are not getting it right when it comes to cases like this?
Yes. They are not getting it right. Some mothers are not getting it right because when you find something like that in your child, the first thing you do is to rush to hospital. For some week, there was one woman that time, he said he was giving herbs. He was going to native doctor and to find that solution. So when they come here, it was messed up. So the child died. So it has happened to so many of them there. Doing a home medication, but it's not done. It's not supposed to be because you don't know what it is.
I'm stressed up. And my work, I'm a civil servant. My workplace, I had to take a sick leave from there. To God be the glory, they granted me. They understand what I'm passing through. So it's not easy on me, but I believe with maybe financially his drugs, I won't think about his drugs. At least emotionally, when I'm thinking about how to get this or get that, even to get the food that he likes, is another problem on me. So financially, I would like to be assisted on that.
It is about surviving, but this is not just about treatment. It is about surviving emotionally, physically, and mentally. And giving perspective to these is a family and lifestyle physician who shares what coping really looks like for caregivers.
It occurs to me that actually 2 of the pillars, we're actually going to throw more light on it as pertains this, discussion. So that's relationship and also stress management. Because another thing you have to ask yourself, you can see when we were in the ward, we could see there was a mother that, I was about to have an interaction with her. She was like, oh, I'm coming, I need to go and get this. She was trying to get a medication. She has to run around, do this. So you can see she's just alone taking care of the child. So you can imagine the pressure she's going through, the emotional stress she's going through. Most likely she hasn't slept in days. Most likely she hasn't eaten a proper meal. So imagine as a female, because Gyna plus talk about women and the challenges. So imagine as a female, maybe she's actually having her menstrual flow while taking care of her child. She's having menstrual. So you can just imagine, just picture that setting. So it's not easy for them. And also, when they're in the ward, they cannot make money. Because guess what? They're not at their job post. So there's also the financial issue. So we talked about the financial, emotional, psychological, physical, because it takes a toll on their health because they're not feeling well. You cannot tell somebody that in hospital setting like this, maybe be physically active, oh, make sure your diet is on point, you get. But now what she needs to rely on is the relationship that will help her to make sure that she still has that level of sanity that she needs to still be a caregiver, right? So now I also recommend to people, like, most of the time when you say, how can I help you? They'll say, oh, don't bother. Insist. Offer your time. So imagine somebody comes and relieve her for some hours or for some days and say, you know what, go and get a good night's sleep. Let me stay overnight with your child. Do you understand? Oh, what would you like to eat? Let me prepare something. Even when you come to the ward and you give these people money, you can see there's a sense of relief they get. It's not as if the money will do much, but it's just that they feel seen. They feel like, okay, somebody is seeing me, somebody is hearing what I'm going through, and they feel that close interaction with failure. Because when you're inside here for a long time, you just feel you're secluded from what is really happening around, that it's only me that understands what I'm going through and all. But I've also seen in cases whereby they build relationship amongst themselves. So some
form a community.
Yes, they form a community and they can relate. So it's like, oh, my child is going through this, my child is going through something similar. So they can, I won't say compare stories, but they can just lean in towards, your strength and, vice versa.
Empathy and all of that.
Because they understand somebody can relate with them.
For Mrs. Anoche, even though the journey was tough, she now has a reason to remain thankful. Her grandson survived nephroblastoma, a kidney cancer in children, and through it all, she found a support system that helped her stand.
My family, they came through. Even my church people came through. We are praying. My family, we are praying. My brother, my elder brother, he's a medical doctor. He's in UK. He spent, if more millions on this girl. Anything they say we should buy, we'll get it.
For the nurses here, it is more than a shift. They watch children fly through pain. That's it with mothers sometimes who are barely holding on. And somehow they show up again the next day and the next.
Cancer is pain. Cancer is in fact, I don't know the exact word to use to describe cancer, but it's just, cancer is not something you can wish for your worst enemy. These children with cancer, they go through a lot. Their parents go through a lot too. The finance aspect of it and all that. So cancer is a terrible disease. But
then again, I mean, the doctors we spoke with said there's actually a cure if they come on time. Have you ever seen a case where a child being admitted with cancer actually gets out alive?
The problem we have here is that they don't normally come on time. They don't.
But you've seen some survival rates working with them. Have there ever been children you've handled that actually came in with cancer and then left back alive?
No.
You've never had that?
Yes, never. They always come at the end stage.
And you think that they can actually be improvement in that area from parents?
I think at times most of them do self-medication at home. So when they start seeing signs and symptoms, they don't come to the hospital early enough. So they will indulge in self-medication, go to pharmacy, chemist, and
when it gets
worse, that's when they come.
While experts say early diagnosis can save a child's life, the question is how effective is chemotherapy? Can a child relapse? And what does recovery really mean after treatment ends?
Most relapse will occur when you do not complete the treatment.
Oh.
Because many times when you start the treatment, the cancer will regress. Okay, mothers will think it's gone. But when you do not complete the treatment, the chances of relapse is very high. Cancer treatment is not just giving drug. There's what we call supportive therapy. Most of them we need blood transfusion. Most of them we need platelet transfusion. because the drug you give, chemotherapy, it kills even the cancer cells and normal body cells. So you need a lot of supportive therapy, and the cost of treating cancer is quite huge. Not many people, including some affluent people, may not be able to foot the bill for cancer treatment.
Behind every caregiver is a need for support, understanding, and dignity.
People around can show support, because if she's not working, how is she getting money to get the treatment that is needed for the child? Especially in a situation where she doesn't have maybe a spouse to help her, right? So that is why in such instances you need a community. So people should rally round, so that, and give them funds in any which way you can. Even if you don't want to give them the physical cash, you can come and say, okay, how much is this child's therapy? Let me fund it. And also, I think that's the whole essence of having this conversation, so that people can know that these people need assistance in any form or shape. Even when you come to see these kids, imagine these kids being in hospital for 3 months. So besides the mom who is, emotionally drained, the child is bored. Children are used to playing, running around and all that. So I also feel that we should come as a community and support them in any which way we can. So when they tell you they need emotional support, come and just listen to them, listen to their complaint, right? Also listen to their fears. Because another thing people don't understand is that these caregivers, especially the moms who are with them, are under pressure of, am I making the right choice for my child? Because the child can't make decisions. So whatever therapy that the child is going to get, is the mom to say, okay, you know what, go with this one or go with that one. Now there's also, the mom feels a certain level of guilt. Is there something I did to warrant this child to have this? So imagine you're going through that. So what you said, the long-term effect is going to be anxiety. So from constant anxiety and fear, it's going to lead to depression, right? So let's not even talk about probable chronic diseases she can get from maybe hypertension or diabetes. Do you understand? Yeah. So the issues surrounding it is just so much that we need to throw more light, so that people can see the need to step in now and really start advocating for them, because these kids don't have voice to speak for themselves. So we need to speak for them to say, okay, see, there are cases which some people do have childhood cancer, so how can we step in to alleviate the stress the caregiver, most of the time the mother, will go through, and also the child. So we should think outside the box and say, okay, how can we make life much, much better for them? And also, when they get this support, they feel, one of the consultants said something about they present late because people go to different, places. Now, also ask yourself, why do they go to some places? Because they feel support there. So I also think from the health sector, we should, be willing to open up ourselves to say, you know what, come here. We have you. We got you, literally. Do you understand? You will get the care that you need once we're able to detect this on time. But come early. I think that's the major thing. Come early, then we'll give you the support.
Childhood cancer doesn't have to end in tragedy. If we catch it early, act fast, and support the families fighting it, we can change the story for many.
Let mothers know, or families know, that childhood cancer exists. Most times people think cancer is meant for only adults. It occurs only in adults. It also or rich people. So it can be anybody. So the message is that early diagnosis, early presentation is equivalent to cure.
My encouragement to you people is, please, when you notice a strange thing in your child's body or is rushed to the hospital, don't stay in the house to start doing your self-medication. Rush to the hospital. When I was coming to this hospital, I wasn't coming with enough money. I know that I'm coming in the right place.
You came all the way
from Soka to this place. Yes.
Thank you.
So much, sir. We're taking your time. Thank you. You're right on time.